Luminous paint.
If I keep watching it, I might think so. Wet paint sign and all.
Jeremy.
What?
Nothing. Did you see that?
I saw it. You didn't change the lighting.
I didn't touch it. Looks alive.
Yes. Jump it up to 1500.
Microscan doesn't go any higher.
We can get 1500 light magnification in microchemistry. I'll send the rock through.
It's growing.
The United Kingdom has become the first country in the world to approve the coronavirus vaccine developed by Pfizer and BioNTech. The rollout will start next week with the over 80s, NHS workers and staff in care homes at the front of the queue. After that, it will be allocated according to age and assessment of vulnerability. The Prime Minister warned that the three-tier system in England and the separate regimes in Scotland, Wales and Northern Ireland remained crucial and that people needed to continue to follow the rules. The MHRA, that's the regulator which approved the vaccine in record time, insisted that no corners had been cut in the process of approval.
This is an historic moment. At last, there is a clear path out of this pandemic, thanks to vaccination. More than 20,000 volunteers got 2 doses of the vaccine as part of the trials. It proved 95% effective at preventing COVID. Getting rid of social distancing and other restrictions next year will depend on tens of millions of us being vaccinated.
We need people to take it. This vaccine isn't going to help you if you don't take it. And you will need 2 doses of this vaccine and most of the others to have full protection.
Leah says she wouldn't have a coronavirus vaccination. She's vaccinated her children and herself in the past, but she's worried about the speed of development this time.
What makes me nervous is that it's being pushed upon us and it's literally like a ransom for our freedom. That in and of itself is enough of a worry, because if the doctor said, right, OK, heart disease is just so horrific, it's our worst killer, the government have decided we've now got to all take statins, I would say no. I'm not doing that. I refuse to take a medical intervention, any kind of medical treatment, that I haven't fully researched myself to decide whether I actually need to do it. That's the first and foremost thing. So why would you put something into your body without really knowing what's going to happen to you?
A new poll shows she's not alone. Just 53% of people said they'd be certain or very likely to get a vaccine against coronavirus, while 1 in 6 said they're unlikely or definitely won't. And some groups are more sceptical than others. 37% of people who believe face masks are bad for health said they'd refuse one.
Hospitals across the southeast of England have begun cancelling non-urgent operations, with some struggling to cope with double the number of COVID patients they had in the spring. It comes as government sources confirmed tonight that there is concern about the new variant of COVID-19, amid fears it could be making the virus more infectious and harder to contain.
One COVID patient at this hospital has made a plea for families to think very hard before travelling at Christmas. He thinks his teenage son may have unwittingly passed on the virus.
If you saw the look on my son's face when I was fighting for my breath, you would not be wanting to send these children all over the country to see their family.
We cannot continue with Christmas.
Tonight, Britain's Boris Johnson becomes the Prime Minister who stole Christmas.
We're sacrificing the chance to see our loved ones this Christmas so we have a better chance of protecting their lives.
Hey, look at us. Look at us. Huh? Who would have thought? Not me.